Hi, my name is Jetrianarda, and today I'll be doing my prenatal teaching video number 2. So first I'm going to wash my hands, find my patient, confirm patient with 2 patient identifier, and then close the door for privacy. In this teaching, I will be teaching the patient which foods to avoid. The first food to avoid, which would be food that include high mercury content, such as fish like tuna and sushi. It can cause birth defects. The second food to avoid would be uncooked meat and poultry, due to the microorganisms that can cause illness to the mother and thus affecting the baby. The third food to avoid would be unwashed produce, because of microorganisms like Listeria and E. coli that may be, on the food if not washed thoroughly or appropriately. The third, oh, I already said third. The next topic to kind of go over would be over-the-counter medications and which she can and cannot take during her pregnancy. The first medication, or a few medications she can take, would be acetaminophen or Tylenol for pain, Tums for indigestion or upset stomach, and Claritin, which is an antihistamine. But just a special note that you can't take all the kinds of antihistamine. Claritin is specific. You can use during your pregnancy. Medications to avoid would include ibuprofen and aspirin, unless the aspirin was specifically prescribed for you by your physician because of developmental issues that can occur or defects. Another medication class that you should avoid during your pregnancy would be antifungal medications, because it can lead to your baby having an abnormal looking face or an oral cleft. The next topic to go over would be environmental situations or areas that the pregnant patient should avoid, which would include disinfectant areas with high disinfectant solutions, so chemicals. It can lead to birth defects. Secondhand smoke can lead to preterm labor as well as birth defects. And then areas with pesticides and lead can also lead to birth defects. For the next topic of alcohol, drugs, and tobacco, they all three should be avoided. Alcohol, because there are no safe amounts that a mother can take, and it can lead to fetal alcohol syndrome, birth defects, brain damage. Tobacco is definitely one to not even consider doing, because it can lead to birth defects, preterm labor, miscarriages, and overall just losing your baby altogether. And recreational drugs, it can lead to brain damage and other defects that you really don't want your baby to have. Travel precautions, it said that you should do it before your third trimester if you are planning to travel, because one, airlines don't let pregnant patients travel on the third trimester because of the possibility of a preterm labor. Other precautions or just tips to do would include taking breaks, walking around, flexing your ankles to prevent DVTs, wear loose-fitting clothes and shoes for that edema. You want to consume foods that are typically cooked or hot, warm, and drink bottled water to prevent any travel microorganisms affecting the mom and the baby. The last topic to go over would be dental visits. For the dental visits, you want to save like any radiology appointments for your dental visits until at least your second trimester. You don't want the newly developing fetus to be exposed to radiology. For dental pain, your dentist may provide or prescribe Tylenol. And then the last precaution to just take note of is if you are needing dental procedures to be done, it would be best for you to save it until after you've delivered your baby, so the complications remain minimal. After I do my teachings with the patient, I would document whatever I talked to the patient about, ask if the patient had any questions, wash my hands, and then perform hand hygiene, and then I would take my leave. Thank you.